Hello everyone, MLA Pete Guthrie here. Across Canada, provincial governments have been criticized for their pandemic response. From blanket restrictions and healthcare capacity limitations to the economic fallout from a shutdown of vast segments of our economy, it is easy to understand the criticism. It's the opinion of many that the approach did not adapt. It was too broad in its treatment of society, and it restricted everyone rather than focusing on those at risk. I think most are appreciative of the fact that when the pandemic began, the lack of knowledge around the severity of outcomes warranted a cautious approach. But the feedback that I've received is that governments didn't reassess protocols or methods as information was gained. In the eyes of many, there was an abdication of responsibility, a deferral to health experts without adequate consideration of all other inputs when problem solving. Things such as economic impact, mental health effects, the exploration of opinions outside of AHS, or the examination of charter and constitutional violations. Additionally, Canadian provinces upheld very similar restrictions with only slight degrees of variation. The logic being, as long as everyone maintains a similar response, no one can be centered out because there was little deviation from the mean. A kind of safety in numbers mentality with no one going contra to the herd. In fact, much of the policy across the country appeared to be driven by public opinion. Opinion based upon polling which reflects a moment in time rather than approaching the situation with good hard evidence. The subsequent result being inconsistent policy and flip-flopping of positions. For instance, up to last summer, there were strong opinions favoring the protection of individual rights, with the sentiment very much against mandatory vaccination and vaccine passports. Most governments across the country opposed these types of measures, claiming that they would never introduce them. However, within a matter of a couple months, public opinion shifted as fears rose, and governments were suddenly prepared to utilize tools that were untested and previously deemed unlawful or unconstitutional. Since then, the populist perspective has swung back the other way, and the importance of upholding and strengthening our freedom is prevailing. As an example, provincial premiers are asking the federal government to lift their vaccine mandate on truckers, and rightly so. Yet, in Alberta, every governmental organization that I know of has implemented a mandatory vaccination policy. Constituents naturally point out the hypocrisy and presume the same demands made of the Trudeau government be applied internally right here at home. Now, COVID may well return with a new variant, but society will no longer tolerate previously introduced measures. The approach needs to change. So, what can we do different? In previous videos, I talked about the need to increase hospital capacity and changes required to AHS executive. But from a decision-making capacity, we have some ideas to explore. First, have a quasi-judicial review of Alberta's COVID response to deal with and make recommendations regarding AHS, the College of Physicians and Surgeons, as well as other entities. Two, create a medical cabinet of health made up of a variety of specialists to provide government with more diverse opinions and options to improve hospital capacity limitations and deal with future pandemic planning. Three, complete a cost-benefit impact analysis to study the effects of the crisis on Alberta's economy and create an advisory board for future consultation. Four, evaluate government communication strategy and look for areas of improvement. And here, I think there should be lots. And lastly, develop a research and development team to explore scientific data and legislative policy from other jurisdictions to analyze the most effective pandemic responses. I have always maintained that creating legislation or regulation supporting populist opinion, even if one agrees with those views, doesn't make it right. Falling into this trap sets a poor precedent and, in my opinion, has governments going down a slippery slope. Let's make sure that we learn from our mistakes. The errors of the past should be the wisdom of the future. Thank you.